Duncan says, if you want to know about business, health, and places to go, welcome to the show. Yeah, welcome to the show. If you know that you want to grow your business, your practice, and portfolio, welcome to the show. Yeah, welcome to the show.
Hello, and welcome to I'm Simply Saying, the healthcast where the spine meets strategy, alternative healthcare takes center stage, and we discuss how to build thriving medical clinics. I'm your host, Dr. Mary Frances Duncan, founder and CEO of Simply Southern Chiropractic Center in South Carolina. I'm a chiropractor by trade in an entrepreneur's body. I'm excited to guide you through this journey at the crossroads of chiropractic care, integrative medicine, and the art of successful clinic management. Lastly, if you take anything away from this episode today, please leave this podcast a 5-star review. Reviews allow us to hear from our listeners and what interests you. So, without further ado, let's get into the backbone of it all. Welcome to I'm Simply Saying.
And welcome to I'm Simply Saying. My name is Kelsey, and I am our host, Dr. Duncan's executive assistant. Before we get into our topic today, I just want to plug all the other ways that you can stay in the loop with Dr. Duncan and her practice. First, if you haven't already, check out Dr. Duncan's website, milliondollarchiro.co, where you can access all of our previous podcasts, you can check out our online courses, and you can have the opportunity to have one-on-one coaching with Dr. Duncan. Additionally, you can stay in the loop by checking out Dr. Duncan's social media at Million Dollar Chiro. You can listen to I'm Simply Saying on all popular streaming platforms like Spotify, Apple Podcasts, and YouTube. Ultimately, wherever you listen, if you like what you're hearing, please subscribe and leave us a 5-star review. Reviews help us know how we can best reach our community. We like to make viewing our podcast for other chiropractors and practice managers as easy as possible. So please note that all red thumbnails are more practice focused. If you are interested in the patient care side of things, that's going to be more of the yellow thumbnails. And then our guest speakers will be in the blue thumbnails to kind of give you a bit of a guide. So this is the most effective way that we can keep all of our guests and our viewers interested in what they're interested in and wanting more from us. So today we're going to be talking about the myths that Dr. Duncan has heard throughout her chiropractic career and really breaking down why they're myths. So I'm going to go ahead and break down all 7 myths that we're going to go through today, and then we're just going to hop into it and really discuss everything and the importance of breaking down why they're myths. So the first myth is you will make 6 figures when you graduate. The second is you can specialize in one type of patient or technique. The third myth is a cash practice is the way to go. The fourth myth that we'll be talking about today is soft tissue therapy isn't real chiropractic. The fifth myth is you need to open your own practice. The myth number 6 is you need to have weekly group health talks. And myth number 7 is don't mention pain and focus on subluxations only. So, Dr. Duncan, kind of talk us through. Let's go ahead and just start breaking down. Let's just start from the beginning and work our way down this list. So, let's go ahead and first talk about myth number 1. You will make 6 figures when you graduate.
Yes. Okay. So I definitely want to address some things that I heard in chiropractic school or things that were strongly suggested that just are not true. And so the first one is that you're going to make 6 figures when you get out of school. This is absolutely not true. This is true. It was true when I graduated. It's true today. And if you are an associate doctor, you're not going to start probably at 6 figures. And sometimes I remember when I applied for jobs out of chiropractic school, we would be given some bonus structures or the doctor that was hiring would say, well, if you can see X amount of patients, then, you can bring in six figures. And now that I've been in practice almost 10 years, I look back to some of those conversations. And I remember one doctor told me that if I saw 500 patient visits a week, that I would, be able to make a bonus. And to this day, I've never seen 500 patients a week. Like, that's a whole lot of patients. Maybe if, our practice had like a busload of kids that were dropped off every day for appointments, but it's just not reality. There are great associate opportunities, and our office is one of those where you can do well. You're not going to start at six figures, but we can get you there pretty quickly. And then if you're owning your practice, that's a complete joke. Like, if you start from scratch, you might not make anything for 2 years. And so, after hard work and you can get your practice off of the ground, yes, you can make more, but that is not something that happens right out the gate. And I think the important takeaway for students, especially, is if you're going to take out these massive student loans and attend chiropractic school solely based on the premise that you'll make a lot of money, that's not a great reason to go to chiropractic school. We go to chiropractic school to help people and change people's lives without unnecessary surgeries and without taking unnecessary medications. And if that's not your sole purpose of being a chiropractor, then you're in for a rude awakening. And so that's just sort of how our profession is, and it's growing and it's getting better, and salary ranges will get higher.
Right.
But right now, I think that is a myth that's sort of told in chiropractic school.
Right. And kind of talk us through, like, is that just something that like is said throughout, like you said, chiropractic school? Is it something you learn before you even get there that you're like, oh, I'm going to make all of this money? Is that like kind of an idea that's consistently being told to you?
Well, I think when you go into a profession and you are going to earn a title of doctor,
Hmm.
you sort of automatically assume, oh, I'm going to make, a lot of money.
Sure.
And our profession, that's just not the case, unfortunately. It is getting better. And I do think that chiropractic schools sometimes strongly suggest that pay rates are a little bit higher, because you've got to see where they're coming from. They want to accept students into the school so that they can keep their programs running. And so there are great associateships. There are great places to work, but they are very few, far in between for ones that are going to get you in, train you, and then, maybe introduce some profit sharing, or, where you get a bigger piece of the pie. That's just that just always isn't reality.
I mean, I feel like that's really kind of the first myth I even think of without even being a chiropractor myself. Just thinking about like, oh, you hear the doctor name and you're like, oh, they just make a ton of money, but that's not the case. And that was really interesting for me to learn on my end of things.
Yeah, and it's not just our profession. Like, my husband's a lawyer. When he got out of law school, he worked at the solicitor's office. That might be the district attorney's office in another state. And I mean, he did not even make $50,000.
Mm.
So, I mean, that's very common. When you start out, you're just not going to make that much. But in chiropractic, sometimes you may never make six figures in some jobs. And I just think people need to realize, what they're up for. We need to be in chiropractic because we want to help people get better naturally. And there are great opportunities, but again, like I said, those are very few, far in between.
Absolutely. I entirely agree. I think when we go through all of these myths, I think just the base knowledge of like, why do you do what you do is so important. So let's move on. Let's talk about myth number 2, which is you can specialize in one type of patient or technique. Can you kind of explain this idea of specializing in one patient or technique? Why do people think it's beneficial?
So I see this a lot. I'm in South Carolina. I'm near Sherman College of Chiropractic. And we get some chiropractors that come out of school that are very upper cervical oriented, which is totally fine. I believe that adjusting the neck and the top vertebrae of the spine can really change things throughout the body. But if you have a patient come into your office and they come in for low back pain and we don't adjust or address their low back and we just address their neck, the patient is, whatever our philosophy is, the patient is not going to understand why we did not address their low back. And so we need to, in my opinion, stay away from very technique specific practices. And now, if you're listening to this podcast, I'm assuming that, you are a chiropractor that wants to grow your practice, whether you are an associate doctor or you're a practice owner, you want to grow your practice. I'm not telling anyone how to practice, but I am giving some suggestions of how to have a successful practice. And this is one of the myths that I come across. So in general, chiropractic has not been around long enough for us to have very specific practices. So for example, a pediatric specific practice or a sports specific practice. And so there just aren't enough of us around, in my opinion, to specialize in a certain technique, to specialize with a certain patient type. And again, this is when you want to run a very successful clinic. I think over time, as we grow in the next 20, 30 to 50 years, there'll be more chiropractors and more patients willing to go to the chiropractor. And we can have very niched out specific practice types. Because when I do business coaching myself, and when I read and hear about other types of practices, like for example, I'll use the law firm example. There are so many lawyers that it's in today's society, it's not going to be to your best advantage to have a general law practice. You're going to have a personal injury practice. You're going to have a family law practice. You'll have a defamation practice. And so law firms and lawyers have grown over the years. There's a lot of them, so they can do that, and they have to niche down, and they can niche down. But with our profession right now, we just need more chiropractors and then patients that are willing to go see a chiropractor. And if you start to specialize right now, you're going to cut out a good amount of your population. Now, I do want to say, some of you may be thinking, well, I know of a very successful pediatric clinic, or I know of a very successful sports clinic. They do exist. There are few far in between, the ones that are successful, but probably those practices started as a general practice, and then over time, organically and naturally, they got a certain type of patient in their area, and that's when they began to niche down organically. And so, for example, sometimes very specific and niche down practices do well in certain parts of the country. For example, if you have a sports injury chiropractic office, that might do very well near an Olympic training center. If you had a pediatric only practice, I would not suggest opening that up right beside the villages in Florida, where there's a geriatric population. So these niche practices, I mean, they do exist, and some of them can be successful, but that is not overall how successful clinics are going to grow. We want to take any and every patient that we can into our clinics, grow them, and then over time, over the next several decades, hopefully chiropractic will be widespread enough, and we'll have enough of us that we can really be specific and really niche down. So basically, my overall point of going through this myth is, you don't want to keep people from coming to your practice. You don't want to go ahead and put up barriers when people,
Right.
Don't even know what the chiropractor is and have to be convinced to go to our offices.
Right, and I thought that was something I thought that I didn't really consider, but chiropractic care is it's so new still. So kind of niching it down is something that I thought I never even considered that being an issue. But putting those barriers up, I feel like you lose the patients that could be coming to your place.
Yeah, we're only a little bit over 100 years old, about 125 years old,
Right.
started in the 1890s. So compared to other professions, we're just not that old, and we're still growing, and things are getting better each year.
Right, absolutely. So let's go ahead and move on to myth number 3, which is a cash practice is the way to go. And I'm sure Dr. Duncan has plenty to say about this one. So kind of go ahead and explain the thought process of chiropractors thinking that a cash practice is the way to go.
So this was a really big topic that was talked about when I was in chiropractic school. Now, this was about 10 years ago, and I still hear a little bit about it now, but it is to open up a cash only practice where you don't take health insurance. And to run a successful clinic, I do not think that this is a very good idea. So there's several reasons for this. So number one is patients, they spend a good amount of money on health insurance and they want to use their health insurance for their health care. And so, if we are going to become more mainstream, then we as chiropractors have to act like other medical professions, like dentists take health insurance, your medical provider takes health insurance, physical therapists take health insurance. And so if we are chiropractors and a patient has health insurance and we don't take their health insurance, then I think it's not a good look for us.
Right.
And then B, patients may not be able, or they don't think that they can afford chiropractic care. Now, we all know this. They may have a high deductible and they're going to still pay a good amount for chiropractic care, but they don't realize that. They think that because they have some sort of chiropractic coverage that their price is going to be better. So we don't want to deny people the opportunity to use their health insurance when we could give them we want to give them a chance to come in, because if we don't, that's a surefire way to lose a potential patient before they've even walked through our front doors.
Right. And so I feel like that also kind of comes back to this idea that we hear kind of in an older generation, maybe kind of we live in the South, so we probably hear a little bit more often, but that chiropractors aren't real doctors. And I think that like this for me when I'm reading this, it feels like if you're not taking the health insurance, then it kind of devalues that in a way. Kind of talk to us about that. I feel like that's really important.
Well, I think you hit the nail on the head. I mean, you're speaking from a patient's perspective, and I
Right.
think that's how they feel. And so, we get a lot of patients in our clinic just by doing an insurance search on their on the health insurance website of the health insurance that they have. And so you'll miss out on patients just not being in network and taking insurance. And another point on this is, we consider Medicare guidelines to be the gold standard for record keeping. And, if you're going to be playing by Medicare's rules, you might as well reap the benefits of being able to bill Medicare or other health insurance
Right.
carriers. So if you're already doing your notes to Medicare standard, then go ahead and bill insurance. And so, a lot of insurances don't cover maintenance chiropractic care. So you're going to use the patient's insurance as an entryway for active treatment. And then once they go to maintenance, a lot of these are going to be cash. That's changing. Some insurances now, very few, they are offering maintenance chiropractic care, but most of them don't. So those are going to be cash patients. So if you want a cash only practice, if you can get a patient through active treatment, they're eventually going to become a cash paying patient once they go to maintenance care. So I think it's just a different way of looking at things. And like you said, refusing to bill health insurance, it only reinforces the idea that chiropractic is not, air quote, real health care.
Right. And I'm interested to say too that like I feel like brings us right back to the first point of why do you do this and why are you a chiropractor, and offering that healthcare opens up so many more benefits to the public to come and visit your practice because they're feeling like they can actually afford going to see the chiropractor, which is a huge factor for a lot of patients.
Right.
All right, so let's go ahead and hop over to myth number 4, which is soft tissue therapy isn't real chiropractic. So I'm really interested in this myth because my chiropractic journey kind of started here at Simply Southern Chiropractic Center, and I I love the soft tissue therapy that we have at our office, and I consider it an integral part of my appointment. So, kind of, would you explain your thoughts on the importance of soft tissue therapy?
Yes, for myth number 4, so high velocity, low amplitude adjustment, so HVLA manipulation, that's always going to be our bread and butter as chiropractors. That's the one thing we can do as chiropractors that other people cannot. So massage therapists can't do HVLA
Right.
manipulation. Other healthcare providers cannot do that type of manipulation. So anything beyond the adjustment supplements the adjustment. And I truly believe that. And I'm not, before we get into this, I want our listeners to know sort of my stance on that. But patients don't live in a bubble. We don't live where we can sit properly all the time at our desk and maybe have a walking pad or a standing desk. That's not always reality. And so, most of our patients, they may lead sedentary lives. They may perform repetitive motions at work. And, they're going to have tight muscles and they're going to have fascia adhesions that require therapies to loosen them up to be ready for a chiropractic adjustment. And so, especially in our office in active treatment, when a patient first comes into the office, if we don't break down those adhesions in the fascia, I can adjust the patient, all day long, but they're not going to be able to hold their adjustment unless you adjust or unless you address the soft tissue that is connected to the bones. And again, I'm giving advice for how to run a successful clinic. And if you have a different philosophy, that's fine. And I do believe in a lot of these different philosophies, but we've got to do what gets the patient better. And the patient has to be, they've got to be willing to come back to your office if they're going to get better, because treatment takes time. And so that's why we introduce therapies into our clinic, because we can get to the end goal faster, and patients are able to hold their adjustments if we're able to work the soft tissue and adjust the bones into place.
Yeah, and I will say, coming from my point of view as the patient, when I tell people that I also have a therapy included with my adjustment, I have had multiple people be like, "Well, a therapy? What is that?" Like, I've been to the chiropractor, and I don't. What are you talking about, a therapy? And that just made me feel like the office was just taking the extra step in making sure that I was actively getting better every single appointment. They were taking the extra step in doing that. So I really appreciated that. So, Dr. Duncan, now that we kind of know the importance and we're talking it through, has this always been an idea that soft tissue therapy is not chiropractic?
I think it depends on what school you go to and
Okay.
what philosophy you sort of adopt. But just real life practice, soft tissue therapy, it isn't incompatible with chiropractic. Doing soft tissue therapy is just using all the tools that we have in our toolbox. Again, therapies are supplements to adjustment. So they're supplementing the adjustment and allowing us to move the bones easier and allow the patient to hold their adjustment better. And so it's not replacing the adjustment. It's just helping us get the patient better faster. And so that's the patient does not care about chiropractic philosophy. They care, can you get them better and can you make them feel good?
Right.
And, when we have a musculoskeletal issue or an issue in the skeletal system itself, our muscles are going to get tight. They're going to guard and protect. And so once we start adjusting the spine, we want to address that tightness as well, because the patient may not realize that they have a degenerating disc, or they may not feel that they have, osteoarthritis, but they do feel the tight muscles and they do feel that pressure. And so we want to try to relieve that through some soft tissue therapy.
Right.
So that's my sort of stance. And again, this is going to help you grow a successful clinic. I'm not saying that there are clinics that don't do
Right.
this, but it's just a myth that soft tissue therapy isn't real chiropractic. Does it replace the adjustment? No, but it does really help us it does help chiropractors get us to where we need to be with the patient.
Right. And I wanted to ask you, just a kind of like fun question for you. Like, when did you enter? I know you started chiropractic care at a younger age. Did you have soft tissue therapy then? Did
Yeah,
you?
I did. So I didn't really know any different. And again, I think that's very school based.
Right.
My chiropractor growing up, she went to Palmer, which is where I went, Palmer College of Chiropractic. And we were introduced from the very beginning to different modalities, and I just didn't know any different. I've really learned a lot as I have interviewed a lot of associate doctors to bring onto our team. I have realized there's some different philosophies about what chiropractic care is.
Right.
And so I think there's value to everyone's opinion and the different chiropractic philosophies. But again, we're talking about running successful clinics, and the patient, like I said, they don't give a rip about chiropractic philosophy. So,
Yeah,
and
absolutely.
the patient is paying your bills.
That's right. That's a really good stance on that. So let's go ahead and hop on into myth number 5, which is you need to open your own practice. Kind of talk us through this myth. Like, what are the benefits and the challenges associated with working as an associate versus owning your own practice? Kind of walk us through that.
All right. So, myth number 5, you need to open up your own practice. This is a complete myth. And I've said this before and I'll say it again. Most people that run their own business have no business being a practice owner. To be a successful clinic owner, you have got to be an entrepreneur in a chiropractor's body. And not everybody is cut out to be an entrepreneur. So I think sometimes to be very successful, at anything, you have to become obsessed with it. And there are times that I've been a slave to this practice. And, that's what it took at that point in my career to make it work and to be successful. And people are just not cut out for that. And, I just think sometimes schools, we have these practice management courses in school, and sometimes, that is an option that is really pushed. But there is a history behind this. I mean, like I said earlier in this podcast, chiropractic is not that old. It's 125 years old. And so for the longest time, your only option as a chiropractor was to get out of school, graduate, and open up your own clinic. You didn't have anywhere to work. I mean, still to this day, we're not employed by hospitals. We're not employed by medical doctors' offices. So in today's world, you can open up your own clinic or you can go and work for someone. And there are a lot more associate doctor opportunities now than there were even 20, 30 years ago. And so, it is hard. You can find a good associateship where they bring you in and they train you and they pay you well. They're few far in between. We're getting more and more of these positions as our profession grows. But many chiropractic school graduates, they're just completely ill-equipped financially and professionally to open up your own clinic. I mean, startup businesses need capital. If you're trying to run your business on a shoestring, you may not be able to keep the doors open, and that's reality. And so, Kelsey, we had a chiropractic association meeting yesterday for our state, for our district. And, you'll hear other chiropractors talk like the chiropractic landscape is not always great for chiropractic owners. We have practices that are really struggling to make ends meet. And, it's hard. And maybe some of those doctors, they graduated years ago. They didn't have another option. They didn't have a choice but to start their own practice. But now that's sort of changing. And so I think if you don't have the entrepreneur bug, and you're a student in school or you're thinking about opening up your own clinic, I would think long and hard about that. And I'll give you everybody a piece of advice here. If you are applying as an associate doctor at a chiropractic clinic, if the clinic is not busy, they cannot afford you. And so I think sometimes chiropractors want this cush sort of job where, they get to spend a lot of time with their patients, 30 minutes. We don't see that many patients during the day. Those type of clinics cannot afford you. And so busy clinics are bringing in collections and they can afford to bring you on. And so that's sort of the reality of what we're facing. But, but if you have that bug and you can manage people. Staff management is the hardest part of owning a chiropractic clinic. If you're good with people and you can take some risk and you can roll with the punches and you're okay when your business ebbs and flows, then go for it. And I think that you're born that way. I think that entrepreneurs are born with that sort of spirit, and you can't tell them no. They can't work for anybody else. And I think that's a very small part of the population. So, in school, if you ever felt like you needed to open up your own practice, that's just not true anymore. And you can find some really good associateships. You may have to look, but they are out there. And this profession, as we grow, there'll be more and more associateship offerings that'll be very lucrative and very good for you.
Absolutely. And I feel like yesterday, talking about the meeting we had, I had a moment, and I think the other doctors that are on staff here kind of had a moment of, wow, this isn't the norm. And we felt very thankful of Dr. Duncan and just all that she's done, because she's right. Like, a slave to the practice is the truth. And she has done an incredible job in doing that, because we kind of got a rude awakening on our end of things, being like, wow, we are very much taken care of by an entrepreneur in a chiropractor's body. So we're very thankful for that and for her. So now we are going to move on over to myth number 6, which is you need to have weekly group health talks. So before we break down this myth, Dr. Duncan, kind of explain to us what health talks are, when you're introduced to them as a chiropractor, all of that. Kind of give us an information on the health talk idea of this.
Yeah. So when I was first coming out of school, I was taught this a little bit in school, and I was taught this from a management company that, and this used to work. This used to be the way that we educated our patients. Is you would have your patients come in on a time that was outside of their scheduled appointment times. So maybe it was during lunch, maybe it was at 7 o'clock on a Tuesday evening. And we would give a health talk, which is, you would talk about chiropractic care and you would give chiropractic education. And, this, in today's age, you don't have to do this, and, you can still educate your patient. So I absolutely agree with chiropractors that really push patient education. Yes, I absolutely agree that we need to educate our patients. We need to talk about what chiropractic is, why we continue chiropractic care into maintenance and wellness. However, you can do this in an office setting while the patient is at their scheduled appointment. So if you're asking a patient to come in 3 times a week, in the beginning of their treatment plan, they can't. It's hard enough for them to get here those 3 times, and to
Right.
ask them to come in an additional time outside of their scheduled appointment time. That's really hard, especially if they have a young children, if they are having to coordinate with a spouse with either a ride to the office or sports games, piano practice and things. That can get really hard. And so we're sort of the only profession that still gives these health talks. And honestly, like, I sometimes think the health talks, they sound more like a timeshare presentation or like a multi-level marketing pitch than something that a medical office should really be doing. So the way we do this in our office is on the patient's 4th appointment, we do our patient education. So the 4th appointment may sound like an arbitrary number, but there's really a method behind this. So once the patient has come in for their first 3 appointments, they are starting to feel a little bit better. In the first appointment, it's all about the patient with their new patient exam. And then the second appointment's the review of findings. Yes, in our office, we do treat on the second visit, but the patient has just gotten so much information. They're trying to drink water from a fire hose
Right.
after looking at their x-rays. And so that's not a great time to bombard them with more information. Visit 3, they're still digesting the information that we've provided, and they're starting to ask a few questions. And visit 4, they're starting to understand the process and they're starting to feel a little bit better. And this is when we start our patient education health talk or class. And so keep in mind, this is during a regular office visit. The patient in our office, they do receive their attended therapies while one of our staff members goes over. We have a little PowerPoint, it's a Canva presentation. And so our staff member is in the room with them so they can go through the little class and then they can answer any questions that the patient has. And so we just want to respect our patients' time. So we combine the educational presentation with their treatment. It is very important to educate your patients, and this starts on day one at the new patient appointment. We educate them again in their review of findings, and then throughout their treatment, we are talking to them about why they are here, what is chiropractic care, how does it work, and you go ahead and you talk about maintenance care in all these sort of checkpoints. And so that way, repetition is what sticks with the patient. And then they're ready to go, hopefully, into wellness care and understand why we are suggesting it at the end of their initial treatment plan. So, yes, there is a need for a health talk or for a presentation on what is chiropractic care. I just don't think that we have to do it outside of patient hours with our busy schedules, the way they are now. So,
Right. And I really, I mean, again, on the patient side of things, I know so much about my spine. I know so much about chiropractic care. I know so much about the importance of maintaining your chiropractic care. And I have just learned that from going to my appointments and being informed by when I'm getting my therapy, I'm having someone talk to me. I'm always available, and the staff is always available to ask questions about why is it important? Why do you do it? And that's something I feel like just combining the two would save everybody a little bit of stress. So I think that's a really great point to focus on. All right, so now we're going to hop into our last myth, which is myth number 7: don't mention pain and focus on subluxations only. I don't know what this means, and I really want Dr. Duncan to kind of break this down and explain to us why this is important. On the patient side of things, it's good to be informed, and on the doctor side of things, I'm sure that all of the doctors who are agreeing and are like, yes, let's focus on it. So go ahead and talk about it, Dr. Duncan.
well, Kelsey, you are a prime example of why talking about subluxations is hard for patients to understand. You have no idea what a subluxation even is. And let's be real, does it matter?
Right.
It does not. You need patients to come into your clinic so that you can get them better. And whether you like it or not, patients who are in pain are looking for pain relief. Yes, are we wellness doctors? Yes, we are. Are we chasing pain? No, we're not. But the patient doesn't understand that. Now, once they've been in your clinic for a little while and they've been through treatment and you go through your education process,
Right.
they may realize that, but that's not always why they initially come into your clinic. And so your patients want to know first and foremost that you are going to get rid of the pain and you're going to be judged on how well you can do that. That's how the patient's going to judge you, whether we like it or not. So failing to discuss pain at all is really a terrible strategy when your patient is primarily concerned with pain relief. This also goes back to what your chiropractic philosophy is, maybe where you went to school. And so, I think there's value to chiropractic philosophy for us as chiropractors, as a whole. But again, the patient doesn't understand chiropractic philosophy. And so we need to address the reasons that they are coming into the clinic. And usually it's going to be for pain relief. Now, you may, get a one-off patient that moved here from another state and they were already under maintenance chiropractic care, and that's what they're looking for. But that's probably not the initial reason why people are going to come into your clinic. We're not, at least our clinic, we're not pain doctors. Like we're not like a personal injury sort of pain clinic. I mean, we
Right.
are a wellness clinic, but that is just learned through education. So some chiropractors, they care so deeply about the philosophy of chiropractic that they just sometimes lose sight of what is most important to the actual patient. So patients, other than chiropractors who are patients of other chiropractors, do not care about the philosophy of chiropractic. They're not going to care about subluxations. They're not going to care about straight versus mixed chiropractic. Patients want to know if you're going to get rid of their pain. And so if you're listening to this, you're probably listening to this because you want a successful practice. And this is just a tip I can give. If the patient comes in with knee pain, then talk about their knee. And you
Right.
can talk about how it's connected to their lower back, and maybe their lower back really is the issue. But if you don't address that knee and you don't touch that knee and you don't do any therapy to that knee in their first couple of appointments, they're not going to come back. And if the patient doesn't come back, then you can't get them better. And also, if the patient doesn't come back, you're not going to be able to keep your clinic doors open.
Right. And you might have the best intentions, I feel like,
Right.
by fixing that lower back. But from the patient's point of view, they're walking out every day thinking, oh, well, they're not working on my knee. Why are they not working on my knee? And they don't even know, oh, it's because it's not even associated with that, or it's because of another thing. So I really, that cleared a lot of things up for me. So thank you, Dr. Duncan, on explaining that. I think pain is not the focus, but it needs to be a conversation in order to inform your patient. And again, back to all the other conversations of educating your patient and why do you do this? What do you do this for? Is to make them better. So I really can appreciate that and learning from that. Thank you so much for listening. We are so thankful that you checked out I'm Simply Saying. We love empowering our listeners with the knowledge of chiropractic care and entrepreneurship. If you're curious about ways to stay in the loop about Dr. Duncan and her practice, feel free to check out her website, milliondollarchiro.co, and you can also check out her social media at milliondollarchiro. You can listen to I'm Simply Saying on all popular streaming platforms like Spotify, Apple, and YouTube. Like I said in the beginning, ultimately, wherever you listen, if you like what you're hearing, please subscribe, leave us a 5-star review, let us know what you'd like to hear and why. Reviews are helping us to know how we can best speak to our community, and they're always a good boost of encouragement as well. So again, we just want to thank you, and thanks for checking out this episode today. Bye-bye.